Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona and I'm joined again today by the amazing Dr. Alex Grinberg. If you've not met Dr. Alex before, he's done a few amazing podcasts with me. I'll give you the short version of his amazing resume because it is a big, long, extensive one. But Dr. Grinberg trained in Russia, started his medicine degree back when he was 16. So he's been doing it for a long time. Not to say that you're old, Dr. Grinberg, but that 16 is a very young age in anyone to start a medicine degree. He has a special interest in biohacking, longevity, peptide therapy. He was training under Dr. Kavishan, who is the grandfather and the founder of peptide therapy. He's got a huge interest in virology. He works for government agencies. He sits on the research board of big research grants. I know that he's on one here at the University of Adelaide in Australia, as well in the US. And I know he consults and works with the US Health Department as well for all things virology and drugs coming to market. And he's got a special interest in AI and how that connects into better enhancing our understanding of health. The resume is long and huge. And if you want to hear more about it, I'll put the link to Dr. Grinberg's practice below. He is also a psychiatrist, so he's got an amazing background and understanding of how the human mindset and mental health plays an impact on disease. So Dr. Grinberg, thank you again for your time and your knowledge and your expertise and wisdom. It's always great to have you on the podcast because I always learn so much from you. And today we're going to talk about one of my favorite topics, and I know it's one of your favorite topics because it's something that you and I are quite passionate about, and that is biohacking. And the term biohacking, is it even relevant to people with kidney disease? Because people with kidney disease might be listening to this going, why do I want to biohack and improve my longevity when I'm not getting quality of life? And these are all the questions that we are going to dive into and pick apart today. So firstly, Dr. Grinberg, thank you. And welcome.
Thank you very much, Fiona. It's always a pleasure being on your podcast.
Oh, thank you. And let's just dive straight into it. Biohacking. Let's start there. What does the word biohacking mean? Because a lot of people listening have quite preconceived notions about it. They might think of people like Brian Johnson, Dave Asprey. They're like, is that just biohacking your mind? Is it just living longer? Am I going to have bigger muscles? Like what on earth does the term biohacking mean, and why is it important?
Well, I believe that biohacking stems from inherent people need to break into the code. And code of life, code of their health, code of their well-being. People want to take an active role into this process and to be able to do more to help themselves, to learn how to help themselves. And obviously biohacking is different things for different people depending on their background, their education, and their understanding of their needs. And I think it ranges from high-level molecular biology, genetic interventions on one side to changes in lifestyle, healthy choices of diet and lifestyle, finding appropriate nutrients and supplements to improve your life and your well-being on a daily basis. And in between, there are, of course, different people with different needs, people who use biohacking for different kinds of enhancements, cognitive, athletic, sexual enhancement. Part of it is a brain hacking that has to do with improving, studying deeper, getting deeper understanding of one's own brain functioning and doing something to improve it or to modify it in the desirable way. And so it brings us to the point that as any kind of hacking, when we break into something, it has some risks and benefits. And when it's computer hacking, it may be very exciting, but at least it doesn't cause permanent damage and it doesn't have risks related to intervening with our own health and with our own physiology, biology, genetics, that can all be happening while we biohack ourselves. So definitely biohacking has much more risk than any other kind of hacking. So then it has much more risk than any other kind of hacking. So people should realize it from the beginning. And so what would be helpful for people to minimize the risk and to maximize the benefits would be to create an algorithm. And I believe the hacking, the biohacking is about algorithm. First, what is biohacking for me? So what is my purpose of biohacking? Second, what am I starting with? So what is my health status? How do I feel now? Where I see how I see my health, say in 3 months, or 1 year, or 5 years. I'm giving simple examples, so there are many more.
But you're like saying you need almost a business plan. Excuse my video because it keeps cutting in and out. But you're saying it's like having a business plan. So before you start to do some big interventions, it's about going, why am I doing it? What do I want my outcomes to be? Where is my starting point? And how am I going to make these interventions and measure them to make sure that any interventions I make are actually pushing me down the route that I need to and are in alignment with the outcomes that I'm trying to gain. Did I hear that right?
Exactly. So those are main points of this algorithm. And between them, there are so many different ways and means to achieve them. So first, let me elaborate a little on each of these main points so people have an example and then they can apply it to themselves. So, so starting point, what do we have? So how good is our health assessment at the starting point?
It's important because if you don't have a good baseline, how do you know if you've improved or not?
It's very important, and it already requires a certain level of doing significant homework or certain level of education to find out what you may need to check. Because obviously for biohacking, it would be better to know the starting point better than just having results of once a year checkup where people check their cholesterol and blood sugar and blood pressure. I don't want to downsize this, but it's also very important to have these yearly checkups. But for good and I would say conscious and differentiated biohacking, you need to learn much more about your body and your functioning.
So give me some examples. Yeah. So what are some examples of that? Because most people either don't know what tests to look for, they don't even know what a baseline of a biohacking intervention would look like. So run me through some of these.
It's would be very important and interesting to mention that at present nowadays we need independent of age, people of even very young age may have problems that they wouldn't expect, like toxic load in their bodies. One thing, a level of certain inflammation or spike proteins because they went through COVID or had a Lyme disease or exposed to many other things. People are traveling now a lot, so there are a lot of global things that affect people's health, and unfortunately there is a global pollution as well that creates high exposure to toxins everywhere and for everyone, from plastics to mercury. Then, definitely another thing is any age is having this problem. From newborns to centenarians, it's biome status. That's extremely important. That's extremely important for biohacking, and even very young people who haven't used antibiotics or something else may have very poor status of biome and also leaky gut syndrome. And even at very early age, because of this, of high inflammatory status and chronic inflammatory conditions, they may have secondary conditions related to this, like metabolic syndrome, mitochondrial attrition, telomere attrition may happen at a very young age. And it should all be considered and should all be checked by available means. So some of these parameters that I just mentioned are hard to test and require extensive and expensive testing, but some of them have indirect reflection in the lab testing, even standard like comprehensive blood chemistry. When reviewing blood cells count with differentials and with preferably with also getting populations of lymphocytes can provide more and more information, and when interpreted by physicians trained in integrative or functional medicine can be even more valuable for giving actionable knowledge for plant biohacking. Then, of course,
I'm going to interrupt you. Sorry, Alex. I'm going to interrupt you there because I think that's an important point that, you know, I have so many patients come to me, and I don't know whether you see this, that have got standard blood tests and doctors are saying that everything is okay. And I'll look at them, and because we've got a different lens of how to look at them, that you can actually glean a lot of information out of a standard test. One of the great things I learned very recently is, for instance, an RDW on a standard red blood cell test will tell you what stem cells and stem cell exhaustion in the bone marrow, which I didn't know about. And most, I can tell you now, 99% of your general physicians and doctors don't know that out of a general red blood cell count, you can pull stem cell exhaustion levels from an RDW level. So I just want to interject there that if you're thinking about biohacking and doing longevity medicine, that even some of the standard blood tests and parameters, if you're trying to keep your costs down, are very good and highly skilled physicians, such as yourself or someone that's gone through extra training, can pull some of that information out of normal blood tests. But your standard GP has no idea, and it's no fault of their own. They've just not had that extensive training into what all the nuances are. So sorry to interrupt there, but I just wanted to make that point that standard blood tests can give you quite a bit of information if you know what you're looking for.
I would say that regular primary physicians, their primary goal of their training is prevention and treatment of acute diseases.
Perfect.
And then prevention of chronic diseases, of course, and help is this, but it's mostly, I would say, remedy of diseases oriented. And but things that are, well, let's say, below the level of concern, but I would say are very important for longevity point of view, from the point of view of extending a healthy lifespan. It requires different awareness and different knowledge and different expectations that physicians who practice longevity, age reversal, regenerative, integrative, functional medicine do have, because we study, we're ready to work with a patient under this angle.
Exactly. So sorry, I interrupted you. So you were talking about cytokines. So let's go back to cytokines.
Even before going to cytokines, there are things that are not routinely checked by primary care physicians who definitely can add them, because these tests are on the panels of all major labs, like C-reactive protein level. And but I have to comment also. Also, primary care physicians will not question patients the same way that we question patients for longevity or integrative medicine. It's not. It's less important for primary care physicians which exercises you perform better, short and explosive or long and like endurance exercises. It's not a part of the patient. Or they wouldn't ask you how you feel after you consume some carbohydrates. Do you have like more pumping in muscles, so you feel you perform better, like a long run? I'm saying, for example, things like this, but it's all different angle. In integrative medicine, we want actually we question patients having in mind to check what is his genetic or mitochondrial level of energy production, how good, what is the level of this person metabolic flexibility, and also indirectly understanding what is the level of his or her one stem cells exhaustion, because it also, upon further questioning, we will see that obviously this patient has, we suspect, low level of stem cell exhaustion, and this person has a very different picture. And even working with cell medicine companies, we know that different stem cells in the body, the same body, have different telomere lengths. Like, for example, talking about hematopoietic bone marrow-derived stem cells, usually, unless someone is very young, they have shorter telomeres than, let's say, stromal vascular factor, that is the stem cells derived from fat tissue. Why? Because bone marrow cells, they divide so frequently. Of course, level of division of all these blood cells is much higher than level of division of fat tissue-derived stem cells. And that explains why these fat tissue-derived stem cells are so good. They have very probably longest telomeres compared to other stem cells that we can study in human body.
That's why they're the ones that we often inject.
At least the ones that have, compared to other commercially available cloned stem cells, they probably have longest telomeres.
Yeah, makes sense.
Because even when people lose weight or gain weight, usually fat cells, primarily they accumulate more and more drops of fat versus dividing.
Yeah, well, this is true too.
And as we know, division is good, cell division is good, but at the same time, it gradually causes telomeres to shorten. So it's...
Yeah, exactly.
Yes. So this is, sorry for this deviation from main course, but it's important. It's important to illustrate how these little things, if you focus on them as an integrative medicine physician, you will question and assess patient in a different way. So it will help to pinpoint certain things, even using routine standard labs. So I mentioned C-reactive protein. It would be better if it's high HS-CRP, that higher specificity protein. Then frequently people, they don't have obvious problems with thyroid hormones. Like TSH level is okay. Usually primary, usually checkup is satisfied with just checking TSH. Less frequently they check TSH plus T3, T4, but only when there is obvious dysregulation and changes in these numbers, they may order additional tests or refer patient to endocrinologist. At the same time, there is a vast majority of people having, let's say, early stage of Hashimoto. They may not have any changes in hormones, but at the same time, they have antibodies against different thyroid cells and thyroid products, hormones, and that eventually will cause clinically detectable problem. But before it happens, the year may pass by, depending on body ability to compensate for this. At the same time, these people have some additional symptoms. They get tired easily, they may have brain fog, they may have some mild pain in their joints, they may gain weight easily, or they may not lose weight when they give them Ozempic or Mounjaro. It's all so many nuances not picked up by regular medicine. And
I think that's an important point. I think, at the end of the day, you know your body better than anyone, that if you've got symptoms or things that are progressing, that normal blood tests say that everything is normal, which I hear patients say all the time, is to go and see a functional medicine practitioner that can do more integrative testing and to notice that your body will give you signals far before disease manifests. But to be listening to those and seeking out a physician that will do the testing to have a look into that. Again, I can't tell you how many times patients will come to me and say, well, the doctor says everything's normal. And I can look at it and go, well, you've got raised ANA levels, or you've got, your reverse T3 is elevated, your vitamin D is in the toilet, and your your HSCRP is at 7 and your EGFR is at, 72. I'm like, we've got a lot of stuff going on that if we get onto it now, and this is the whole point of biohacking, right? Prevention better than cure. So again, I think as a patient, to make sure that if you have a feeling in your body that something's not right, and your doctor's saying the blood tests are normal, is to maybe get a longevity medicine, functional medicine, integrative practitioner to also have a look over it.
Exactly. I absolutely agree with you, Fiona. And actually, you mentioned ANA. So next thing I wanted to mention is ANA. But for bigger picture, I want to say that even healthy people who want to see me for longevity, I have a prerequisite, a number of tests, all tests available in all common clinical labs. But I just check for more parameters, and then I see kind of triangulate and see correlations between within the normal range. They can be high normals, low normals, like you mentioned about EGFR and these things, and that require a lot of further deepening and differentiation.
Yeah, and I think that's really important when we're, like you say, you're setting parameters about, your longevity journey and what you're going to do, that these tests are really important to get information about your starting point. So I think that's good. So let's move on to the next bit.
I just wanted, pardon me, please, but I would just wanted to add one little information that would be important for our viewers about ANA. So it's very interesting. ANA is very dynamic parameter, and I see even when people have normal ESR and CRP, sometimes titers of ANA increased, and it's such a sensitive indicator of autoimmune tendencies, because I see it if people have chance, and I check their blood even weekly, I see significant variations in ANA. They just got little virus, they think they just were under weather for a couple of days. ANA titers may jump up to 3 times. And they were taking some supplement, ANA titer may be up. They have heavy workup, it may be up. So, and it gives us an idea, and with this particular person, what particular triggers autoimmunity, because I've seen people having first episode of lupus after running 100 kilometers run. Absolutely healthy people. Or other people develop lupus after too much sun and exposure to ultraviolet, or after taking some medication. So it's very good. I just give simple example to get better understanding of your own body. See why your ANA gets up, what raises your own ANA. Maybe you should avoid this. Maybe instead of doing expensive gene testing, you can see just phenotypical expression, why your system reacts in this autoimmune way. Because sometimes gene tests give very inconclusive results, and most of them are prohibited from giving any clinical implications of what they see. That's also very important. That's why frequently in the results, after doing very expensive tests, you find that you need to take more glutathione, folic acid, or vitamin D. And obviously, less expensive clinical tests, commonly available clinical tests, could help you to do this, and this amount of money you could use for something more productive, like high quality supplement or banking your stem cells.
Yeah, and I want to make that point. And thanks for going back to ANA, because I think it's a very underrated test. I mean, I see a lot of people with MS and Parkinson's, and I would say 60% of my MS patients have raised ANA. So I go, okay, they've got an autoimmune tendency, and then others don't. And it gives me very specific information about how to treat a patient, of whether they're autoimmune versus maybe more inflammatory and those sort of things. It's an underrated test. Most doctors say with it slightly elevated, it doesn't mean anything. You and I would go, yes, it does. The other thing I want to come back to what you mentioned is lots of people, and again with people that are amazing, like Gary Brecker, who's been all over the podcast lately, are talking about having gene tests and then taking whether to take, if you've got the MTHFR gene, and whether to take activated folate or not. My point to that is most people have one of the MTHFR genes, the C677T. I think it's 67% of the population will have heterozygous expression of that, meaning one gene fold. The thing about gene testing is that just because you've got the genes doesn't mean that the gene's active. So that's where what you're saying, just so everybody understands, is that functional pathology testing will tell you whether a gene is up or down regulated and what's happening via that biochemical pathway. And I also want to say that people have done studies, and we know about the nocebo and placebo effect. And then if you have an extensive gene testing done, and say you've got APOE4, and someone says, I'm thinking of Chris Hemsworth here that did the Unbreakable thing, and he's like, well, he's got a really high risk of Alzheimer's, and people made a big deal out of it. Yeah, okay, but that doesn't mean the gene's expressing. If he's got really good fats and a whole pile of things, he can really prevent it. But what they found in the studies that if you've had intensive gene testing, and I go to you, Dr. Grinberg, you've got the APOE4 gene, you're really high risk of getting Alzheimer's, that people that were told that information versus the people that weren't had a much higher risk of going on and getting disease just from the placebo effect of being told that they would. So while I think gene testing is useful as a primary care physician, when I'm doing gene testing, and I do a lot of longevity work with young males, I always say to them, just because you've got a gene, it doesn't mean anything. The functional test, and we call it a Nutristat test, which goes through everything, ANAs and vitamin D and homocysteine and HSCRP. I'm always looking at that to see what's actually firing in the body. And I will look at the genes in the background, but it's not my primary focus, because I don't want to put into people's heads that they are more likely to go on and get a disease. I'm looking at preventative stuff and saying, well, these are the interventions that we can really put in here, and why, versus dropping into people's psyche that they may, that they're 50 times more likely to get a disease. So I wanted to address that, because I think in the longevity medicine, and it's really popular at the moment, that gene testing is the be all and end all. And I don't know, I'd like to hear your take on this, but I don't think it is. I think it can be dangerous when we're just relying on genetic testing and then telling people that they're going to get diseases because of the placebo-nocebo effect.
Yes. Thank you so much for bringing this up. and definitely I want to comment on this. And it's very important you mentioned that if some gene is active, so specifically if some gene with significantly mutated gene is active, most of the time it translates into clinical condition, and
Exactly.
And even more likely in very bad, very dangerous, and very rare, it's a genetic, what we call genetical disease. So for this reason, people should understand, my dear fellow biohackers, I consider myself as a biohacker, and probably started from age 5 or 6 years old when I got interested in extended human lifespan and tried to find things that I should.
5 or 6, okay. I'm not even going to comment on that, Alex. That's so. Like I say, I always say you're a bit of a savant. So that's 5 or 6-year-olds thinking about that is not normal. Just for anyone listening, if they wondered why, as a 5-year-old, they're not wondering about how to extend their lives. That's no wonder you're.
First started, I wanted to extend the life of my parents, so I was asking what can be done.
Okay, that makes sense. But wow, that's young. So sorry, I interrupted, because that's a bit mind-blowing for me. So keep going.
So in case when the gene is significantly mutated, usually it either expresses as a very acute and tough clinical condition, or something starts to be seriously wrong from the beginning. And this is one way. So, but for these genes, there are some relatively rare genetic abnormalities. And for these genes, they are well known in medical community. For this, here is a medical genetics, and they have specific tests for this condition that can be done to test specifically for this gene. So it brings us to next question, and next very important point for biohackers. If you decide to become a biohacker, please be ready to educate yourself very seriously. So, for example, like you, Fiona, mentioned some genes that may be involved in developing Alzheimer's disease, things like this. I'd say some young person wants to biohack because both of his parents or grandparents developed Alzheimer's at very early age. So even internet So here is most important to find keywords for research. Are there genes that specific and absolutely for sure responsible for developing Alzheimer's? So they will be expressed 100%, and at a certain age they will be responsible for developing Alzheimer's. So for this basic search, internet probably will give an answer that there are no definitive genes that can tell you for sure that it's inevitable to develop Alzheimer's. And with most genes, even for specific breast cancer genes, they usually give probabilities. No one gives 100% guarantee that some disease will develop even if this certain gene is expressed. But so in medical genetics and testing, the questions based on probabilities, they provide, response, they give probability of developing certain condition. So my point is that if biohackers want to prevent some illness, let's say, well, one of the parents had severe type 1 diabetes or some rare vascular condition of some rare neurodegenerative condition, atrophy, they can, for this specific diagnosis, they need to find out are there genes that definitely with high probability will trigger this condition. If there are, they may ask consultation of medical geneticists to find clinical labs and test for this specific gene to see how is it? Do they have this mutation? Is it partial? Is it inherited from only one parent, or they got it from both? Is it related to their gender, and so on, and so many things that genetic specialists in this area can tell them. This is a high, I would say this is a very useful and very efficient way to do something. Otherwise, people get tested for common mutations that don't give them definitive answers and don't lead to significant modification of their choices for their own biohacking.
Yeah, no, I definitely agree with that. So let's move off the testing and let's move into what is biohacking? Like, what does it look like? Like, what are, you and I are really into our peptides and bioregulators and things like that. But biohacking, people talk about cold exposure and infrared saunas and the Mendi and vagus nerve stimulation and nootropics. Like, the pool of interventions is huge. Where does someone that wants to get into this start? They've got their baseline, they know what to do, and then they're like, what am I doing? Am I saunaing? Am I taking peptides? Like, help, where do I go? What's next?
Let's move to this exciting item. And to move smooth transition from previous question about testing, I will start with hormones, because hormones are so important, and it's like a juice of life for everything and for everyone. So I will add, talking about biohacking your hormones, you need to have good comprehensive hormone testing, and it's much more than regular tests get, and it's much more, and it's probably 4 times more hormones have to be tested. For time's sake, I will not, of course, describe one by one, but there are so many of them to be tested, and also related things, and also functionality of hormones, particularly for cortisol, not just level of hormone, but many hormones have pulse production. And now, particularly in the field of very delicate and highly customized peptide medicine, I would like to check certain hormones many times a day to see if my intervention triggered and maintained pulse production, whether of gonadotropin hormones or growth hormone, renin hormone. So it's very interesting area at the age of neuroendocrine interface. So you need to check not only many hormones, but you need to check their functionality. 24 hours levels, and for some hormones, level of metabolites, because it's also important how they get metabolized. If, let's say, male steroid hormones get aromatized into female steroid hormones, so many things that very important and very interrelated. Let's say excessive fat tissue, fat cells, adipocytes have receptors that are templates for aromatization. So you may have higher total testosterone, but huge part of it, in addition to turning into free testosterone, will be aromatized and will kind of counteract the effects of testosterone that male patient wants, right? So it's just one simple but extremely important example. So many other things related to hormones. It's receptor sensitivity. And if people biohack, some people in biohacking have short-term goals like for sport, enhance sport performance, athletic performance, gain muscles, and they may turn to use of certain hormones. So SAR, so-called SARMs, that affect sensitivity of receptors to steroid hormones, and I'm sure there will be developed other compounds that will affect sensitivity of receptors to growth hormone, and of course. Target is also insulin sensitivity in good and in positive and negative ways. So certain interventions are not, I would say, not conscious use of even peptides that trigger growth hormone release or involved in different ways of inducing more effects of growth hormone. And they can also affect insulin resistance, and you should also consider this, and it involves a lot of testing, and depending on the complexity and sophistication of the protocol, more and more frequent and more wider testing. So next, I started with hormones. So people use hormones for hormone replacement to maintain their well-being. They use hormones for shorter period of time for achieving certain clinical goals, but also insulin is a hormone, and at the same time is a peptide. It's a known substance. So other than hormones, people use. So I will just mention different approaches to biohacking. People use peptides. Peptides, in their turn, may affect hormone production, may act as hormones themselves, may change metabolism in the way that certain hormones become, even in the concentrations we have them in our body, will be more active, and the receptors to them probably, and the target organs will be more reactive. So in so many ways. And of course, as we mentioned, depending on what we want to achieve with our biohacking, is it long-acting effect? Is it all-encompassing effect, system-wide effect? Is it, or we want to prevent certain illness? We can turn to each of the items we will discuss now, including hormones and peptides, have many things to offer. But again, people should be aware what they do, why they do that, and what the end goal is. And if they achieve this end goal, are they going to be happy with this achievement, or they will realize that they missed broader or longer term goals? So it's very important as well. So then this area of, again, as any business plan, everything depends on funds and budget. So depending on the budget, people may turn to use cell therapies, and I love this area of longevity and age reversal medicine, because so many tangible results can be achieved. But at the same time, people should realize that now scientists think probably of 5 different levels or generations of hierarchy of stem cells. But it's more complex than this, because even if they find something level 5, maybe it's good for regenerating axon and neuron, but maybe not so good for muscular or skeleton rehabilitation, and so many things that are still to be learned, and also to check articles and research on this, and to understand, to at least make some speculations what may work better for this and this person, and what may be counterproductive. And of course, for cell therapy treatment, like you mentioned, stem cells exhaustion, it's very important to measure. But again, when you measure something, it's advice for all biohackers. Also, you need to do your due diligence, how they measure it. If you have time, check if they had articles in solid and respectable medical periodics about the study, if they have patents about this, so many things to check, because there are a lot of claims that can be made in biology, things that show great biological response in mice. Many scientists will tell you that very rarely you can translate it or extrapolate it to the human, but even more difficult to make parallels with treatments, because mice are extremely they are extremely resilient, and now many scientists prefer that or add the term of resilience to longevity, and it's because it's really hard to predict if someone lives 150 or 200 years from our intervention today. But we can measure the level of resilience he or she achieves now. And based on this, it would be logical to believe that any additional day with more resilience and with better health translates into longer and healthier life.
Exactly. And it's such a good point that, and I want to come back to too, that all these interventions and everything that we're talking about, the cheapest intervention is good, healthy diet and exercise, right? I want to come back to that. Like what I'm seeing happening in the world of biohacking is people are thinking they can take hormones or whatever and bypass all the basic common sense stuff. And the foundation of longevity, I mean, again, if you look at people like Asprey and Brian Johnson and, with their caloric intakes and things like that, whether you want to go that far, but what you eat and your exercise has to be foundational levels, number one, before you go pouring money and resources into all these extra things, because there's no point. You've got to have your foundations laid first. Right. Yeah, I just wanted to say that. So,
for this, I would absolutely agree. And as you mentioned, I have background in immunology and psychiatry, and here you want your body and your cells to feel your love and the gratitude, and that you express it by feeding them right and giving them enough rest and showing that you respect them and take care of them. And it's both on, let's say, spiritual, esoterical, but it's also on level of how our mind and the thoughts affect our physiology. If you give yourself rest, if you normalize, harmonize your lifestyle, your brain, your neurons, the frequency, you switch from, let's say, in simple way, from alpha rhythm to delta rhythm. You almost live in meditative state if you use moderation and a good, respectful approach to your body and lifestyle. And definitely that reduces the activation of adrenal system and symptomatic system. So your vagus nerve more active, you get more acetylcholine, and you would be surprised how it improves your carbohydrate metabolism. If you have wearable monitors, you will see the calmer you are, the more organized your day is, the better your sugar curve is, and the less of the spikes you have. That's very interesting. You check your HRV or check your sleep, you will see how this common sense changes in lifestyle affect all this information that you can check on wearable devices and that is daily available to you.
Yeah,
and of course it's happier.
Biohacking 101 is, good common mind cleanliness, as you're mentioning, good diet and exercise. So I just wanted, you got to layer on top of that. No point spending zillions of dollars on hormones if you're not doing that stuff right.
And then of course it's ideal combination when people are taking care of their diet and lifestyle, and then on top of this they add interventions that we just mentioned. and that would be ideal.
Yeah. So back to, how do people know what interventions to put in place? Is that where you really do need to work with a qualified practitioner? Like, how would I know whether I should cold plunge versus using a sauna versus maybe I want to, I mean, obviously testing for hormones and things like that and peptides, but I mean, I listen to all of this and go, you really do need a functional practitioner to guide you through this. So, because biohacking is expensive, let's be real about it. It's, people want to optimize the things that they're putting in their body and to make sure that they, if you've got a short budget and there's only a few things you can do, I don't think that's something you can do without the guidance of a practitioner. Is that something you disagree on, or how do you see that?
Let me comment on this and let everyone decide on their own. So, for example, as a specialist with huge experience in kidney problems, would you immediately recommend anyone to do cold water plunge?
No.
That answers your question.
It's too depleting on the kidneys, right? We know it depletes kidney chi, so no.
Yes. Well, and the same probably stands for keto diet and for any popular trend in like people who decide follow the trends and do cold water plunge or extreme heat or something else, and just go to IV clinic and ask for huge dose of vitamin B12 or vitamin D. Like simple example, maybe they have bad family history of calcification in arteries, and all of a sudden they get 50,000 units of vitamin D, and that can precipitate calcification in more sensitive arteries somewhere.
Exactly.
Glomerular or coronary arteries, and the same, how many people got tested for G6PD enzyme and went to clinics to get vitamin C IV?
Yes.
A huge amount. So, and how many people in, I would say, among people who call themselves biohacker know about G6PD deficiency and what it does to people if they have deficiency and get vitamin C. So, and it's just, when you know that there is unknown, you can guess how many unknowns are there and how many could be picked up by someone who is focused on this risk mitigation and finding ideal solutions. So who's gonna find what is ideal for you? Cold water plunge or microdosing with magic mushroom? Because as a psychiatrist, I can tell many people upon psychiatric examination, I can tell the psychedelic is not for you. Because I know some people with certain conditions benefited from that, and seekers of some higher knowledge benefit from them. But on my side, I can warn something that with his family history or his life history and symptoms that he experienced, you should be careful considering psychedelics. That's also very important area. I think psychedelic medicine is great. I attend the conferences and get certification there. But I don't want people compromise this branch of medicine, just doing it on their own and without consulting with specialists who can see what degree of risk they're dealing with. So it's very important as well. Same stands for everything. It's some obviously people with just simple example with history, family history of some hematological malignancies, may be more careful considering some modalities or cell medicine maybe. And who can tell them, for you it's better to use exosomes than stem cells? And it's very hard even for biologists who biohackers. It's hard for them to make this decision. What should they prefer, exosomes versus stem cells or versus some other means of cell therapy using like organelles from stem cells? It's very hard for them to decide. For this, you need to integrate a lot of things, from integrative oncology to integrative genetics. So the more complex intervention, the more expertise you need to consider them. For more like baseline intervention, lifestyle, still, because lifestyle interventions ranges from cold water plunges to running marathons. Even for those, you need good and thorough medical advice, taking into consideration family history, your previous history, how healthy were you, how resilient were you, and and also definitely checking if someone creatinine is high normal. I wouldn't recommend him to do water plunge, but basic thing, right?
Yes. Most people don't think about that. So what I'm hearing, and for anyone listening, is that while biohacking is great and there is so much information out there, just like anything else, biohacking needs to be personalized based off individual testing that we spoke about up front, and then working with the healthcare practitioner to make sure that any interventions that you're putting into place are going to give you the results that you're looking for. Otherwise, again, interventions can actually cause damage, say high doses of vitamin D, cold water plunge in the cases of kidney disease. My MS patients, you can't put them in a sauna 9 times out of 10 because of the heat sensitivity, and then they can have a fall when they come out. So I think what we see on the internet and things like that is this great big blanket term that biohacking, you do this, 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 and this, and it's going to work. And I want to come back to that biohacking, biohacking is biohacking your individual biology, and that there is no one size fits all, that you really do need to do the pre-test and work with a qualified physician to make sure what you're hacking is going to give you the things that you're looking for. Otherwise, you can either cause problems, or you aren't hacking you. You're just doing a general hack that doesn't actually give you the results that you're looking for and improve your life and give you longevity. If anything, cause damage. So I just wanted to sum that up for people, because biohacking's everywhere, right? It's such a huge thing at the moment. That's why we wanted to talk about this, that it's far more intricate and nuanced than I think what we're seeing on Instagram and influencers or things like that aren't trained in medicine to know that you have to have all these nuances in there and how to implement things.
Great. Thank you, Fiona. May I add something to this?
Please.
So I think there are 2 very important aspects of biohacking that everyone should consider and utilize it for one's own benefit. So first is a fragmented knowledge, particularly for biohacking. That is, biohacking actually has a very huge ambition to cover system-wide medicine, biology, big data science, and genetics, and combine it in some kind of new medicine. So definitely for this, you need very integrative knowledge. You can't use fragmented knowledge. And it's not a fault of internet. It's just if you're not professional in the area, let's say you study Akkermansia, popular and useful supplement now. And the question is, how do you study it? Like I'm saying, for example, did you check Akkermansia and renal function? Did you check Akkermansia and kidney failure? Something like this. Did you check Akkermansia and chronic hepatitis? Something like this. I'm not downsizing Akkermansia. It's a wonderful product. I'm just saying, for example, but that's how people should do with any product or intervention they consider. Because usually I do biohacking for myself all my life, but on any intervention, I try to get as much information as possible. And like say I see I'm using peptides, and everyone asks me, oh, should I use BPC 157 and TB500 immediately after this injury, this and this? And but I have additional questions. Did you have flu recently? Maybe you have circulating antibodies or spike proteins that will negate the effect of these peptides. Why do them now if it happened? Or many other questions related to other conditions, because even for this, like TB500, it affects stem cells in certain way. It may affect some other cells in certain way, and in some susceptible individuals with a complicated history, it may even some articles indicate some oncogenic potential. So why start with this one? Maybe before this one, I help people to improve their NK cell status and other immune system parameters that will prevent or at least reduce the potential risk of oncogenicity of even good and well-studied peptides. For other peptides that are less studied, I try to check many articles and see what nephrologist says, what hepatologist says, if they were tested for this and this, because usually when any substance seriously studied being researched, there are articles about its specific danger for specific organ, because anything that can be even remotely considered for pharmacological application, they do organ toxicity. So you can find potential organ toxicity for any intervention and anything for yourself. But then how to put it into system, how to integrate it with this person, other conditions, and this, it's not easy. It's not easy for doctors. So probably it's easy, and it's unlikely to be successfully completed by people who self-educate, because usually it requires integration of many different disciplines and also dynamic clinical observation of the person. So one danger is fragmented knowledge. Another, not danger, but things to consider. On another end of the biohacking, we see that there are some individuals who doing very well and actually helped to coin the term biohacking, like Dave Ashley, and who is very brave and pioneer and researcher, but he explains that he is researching on himself. That's his choice. Is everyone ready to do research on themselves? I don't think so. And also you should consider that some people can do research on themselves, but they have huge resources that can help to caution them when something goes wrong. For example, a pioneer and very advanced person in longevity research and biohacking, Brian Johnson, he is doing a lot of research, daily research, 50 plus parameters every day, and with many scientific and clinical minds. He has a big team of doctors and scientists helping him, and they analyze all this data. And but not everyone has opportunity to do it this way. So can you just mimic what they do? I don't think so, because, for example, for Brian Johnson, I see some things that I would be doing differently, like taking from his actually reports, he's taking a lot of supplements at the same time. I don't see if anyone checks biocompatibility of this supplements, or anyone checks the pharmacokinetics and pharmacodynamics to make sure that their synergy is optimal and they potentiate each other effect, or they kind of oppositional, and then directly or through different pathways in the body, they annihilate effect of each other, or reduce it, or just overload kidney and liver by an unnecessary combination, because all molecules have different charges, and how they interact with each other, I don't know. So, or using like transfusions of young people plasma, I usually prefer young people plasma. Mostly has a benefit of having young people high levels of certain peptides and signal molecules that in a good circle, they maintain the genes level of expression at the level of young people, and they produce high amounts of this peptide. So it's good, almost perpetuum mobile, until it's get kind of affected by viruses or environment, or just by time passing by. So, but at the same time, at our time, most young people went through some viral infection, got vaccinated, and do you want to get the mRNA with the young people plasma? I don't know. Read more about mRNA and what it's, what can it do? Virtually anything. So why not at this level of if you have budget, I would do like some plasmapheresis, total plasmapheresis, interventions like this, and then IV injections of some well-checked and studied peptides. And it would remove unnecessary spike proteins, and probably everyone has some level of autoimmune directed antibodies, remove them, and then get best efficiency of peptides that are well studied and person decided to use, or exosomes, combinations like this. I think they're safer, and they have a longer lasting potential, and you may targetedly and deliberately affect genetic expressions where you want. But this is just my consideration. For other biohackers develop at home gene therapeutic vector delivered kits, and they deliver to themselves this gene altering therapeutics that may affect something starting from follistatin to other genes. Some advanced biohackers were able to develop antiviral activating genes responsible for antiviral response. But how do they know they don't have off-site effect? That's gene therapeutics probably are extremely efficient, but at the same time they have highest level of off-site effects, not only because of viral delivery and that may affect some other genes, but also because of developed genetic material. If it, in simple terms, jumps onto certain chromosome and not on the group of genes that are worst case scenario oncogenic and activates them, it's scary. But all other unknown genetic knockout or genetic activation effects, again, as people have a budget that allows them to do advanced things like this, I advise them to create living biological models of their tissues, and to do both accelerated high throughput to see off-site effect of this gene therapy. But nowadays we can combine it with computerized simulation also that can help to see and then when you combine this knowledge from living tissues and computational results, you can get even higher probability of prediction how dangerous it is. And it's up to a person if he decided to use this for his let's say 50% for life extension versus 60% of oncogenic activization. And it's up to people. That's where the beauty of biohacking is. It's liberty to decide, to choose your lifespan, the level of your well-being and your risks. But it's up to the person. This is a freedom. But please do it in the way that is most risk mitigating and most beneficial for you. That's well, that's my message. And again, depending on where you are now in terms of your health status, what means and tools you want to choose for your own biohacking, how far you want to go, and the level of risk you want to take, the approach is different. But I think to optimize everything, please consult, please ask for consultation, help, knowledge, at least to discuss it with as many biohackers as you want, and conferences and forums, and find biologists, and get people involved from different specialties in the forum, geneticists and biologists and physicians of different specialties. And I think now there are a lot of good, high quality biohackers, media groups, and I was always happy to comment on these groups and still are. And I see other specialists and biohackers share very valuable knowledge and valuable questions and insights. It's all useful.
Yeah. And just to add to that before we wrap up, I just want to reiterate some of the stuff that you said is that, one, if you're biohacking, you got to remember people like Brian Johnson, all we're going to learn from Brian Johnson is how to biohack Brian Johnson. We're not going to learn how to biohack Dr. Grinberg or myself. We'll get some great information of what might work, but you've got to remember we don't know that the information of what works for Brian Johnson is going to work for the rest of us. Same with Asprey, right? He's very sensitive to oxalates. I've got other patients that aren't, that can have lots of plants that actually need to have that sort of stuff. So we have to stay away from big blanket statements of this is what works for everybody, because we just don't know that. We cannot ever move away from individualized medicine. I still see that as the problem with mainstream Western medicine, where we blanket and say this one drug or this one thing will work for everybody, and it doesn't. Otherwise, things would be more successful and we wouldn't have half the issues that we do. So I think when we're working with biohacking, you've got to remember it has to be individualized. You're biohacking your own genome and yourself. You're not biohacking Brian Johnson and Asprey and all these other amazing people that are pioneering the way. And I think, too, we've got to remember that biohacking, a lot of it is still in its infancy. And like you mentioned, with a lot of these new, genetic cell medicines that are coming in place, we don't know the long-term effects and things like that. And if, I'm a bit like Asprey. I know you're at the same. I definitely biohack and experiment to myself. I'm taking stuff that I know no one else has tried before and things like that. And that's okay. That's something I'm happy to take. Not everybody's happy to do that sort of stuff. So I think the big takeaways I get from this is a blanket approach won't work for everybody. Please make sure that you do the baseline functional testing and you have a roadmap of what you want to get out of your biohacking, rather than going in there willy-nilly and just doing interventions and hoping they work. Get very specific about that. Make sure your testing checks that, and then work with someone who's qualified to make sure that you are getting the best bang for your buck, because biohacking can be quite expensive, to make sure that the interventions that you use are going to give you the outcomes that you're hoping for. So anything else, Dr. Grinberg, you want to add to that before we wrap up?
Well, I think we discussed a lot of things, and I don't want to overwhelm people with more details. So it's thank you very much, Fiona. I'm very happy to answer these questions, because I deal with people who want to improve this biohacking every day and wanted to share with them my ideas how to optimize it.
So if you're interested in working with a professional like Dr. Grinberg, and like he mentioned earlier, he's been interested in this since he was 5 years old. So if you want someone that's got longevity in this field, this is the man. And I know lots of big companies are now reaching out to him and for his knowledge. So before he gets super uber busy and you cannot get hold of him, I'll put his details in below. I also know he's very happy to answer any questions in the comments. So if you have any specific questions about biohacking and interventions, please pop them in below. I can always reach out to Dr. Grinberg to answer those specifically. Dr. Grinberg, as always, thank you for your knowledge, expertise and passion in this area. Again, someone that's been interested in it since 5 years old is pretty spectacular. So I know you definitely know what you're talking about in this area. So again, anyone that wants to work with Dr. Grinberg, I'll put his details below. If you want to know more about what we do, head over to www.kidneycoach.com. You'll also find us on Facebook and Instagram. And we hope to see you there. And thanks for being part of our community. We will see you next time.
Thank you. Thank you, everyone who is watching, and wish you successful and beneficial biohacking.
Bye.
Bye.